Good day, this is Dr. Freslin Limsako, and in this presentation, I will talk to you about spiritual care in nursing. This presentation covers the topics on utilization of spirituality and spiritual care in nursing practice, and spiritual care in nursing, as well as Filipino nurses' spirituality and provision of spiritual nursing care. So first, let me talk about or discuss about the use of spirituality and spiritual care in nursing practice. So what is spirituality? Spirituality is a guiding paradigm, meaning it's how one looks at things in life. It forms the basis through which patients, who are also human beings like the nurse, can find meaning through their illness and suffering. Spirituality is not only important in coping with disease, but also it has the potential to improve the quality of life in areas such as one's resolutions or meaning and purpose in life. It has something to do also with how one copes with the disease or relief of disease-related symptoms. Another is decreased symptoms of depression or anxiety or even overall distress. It has something to do with enhanced pain management or probably improvement in surgical outcomes. Surgical outcomes meaning what happens after a surgical operation. Spirituality may also reduce risks of substance abuse and suicide, or even lower mortality rates in patients. So, spirituality involves spiritual care, which, when implemented, can help patients to cope with healthcare problems and help them find meaning to their health issues. Furthermore, spirituality concerns our beliefs about our place in this world and it seeks meaning and purpose in our lives. So, as student nurses, you begin to think about the meaning of why you decide to take up nursing. Okay, it's part of your spirituality, or maybe you think about what is the purpose of your life here, and why are you um, thinking about becoming a nurse? What is the meaning of all this, of all that's going on in your life now? Okay, referring to a universal concept of connection with the Supreme Being. So it has something to do with the belief or faith in a higher being. Okay, so Christians call our higher being as God. Okay, and there is also a supreme being referred to as Allah. Okay, or any other being that is higher than the human. So it's related to membership of and adherence to the practice of a particular faith. So tradition or sect that does not necessarily require any religious belief. So that's why some say that religion and spirituality are inseparable, while others say they are different. Okay, so eh, for those who think they are different, it means that one doesn't need to be connected to a religion for one to be spiritual or to have spirituality. It is therefore paramount that nurses integrate spirituality into their nursing practice, while at the same time being aware of and at ease with one's own spirituality. Following a similar trend, Deal and Barlow commented that using spiritual or religious resources gives patients and families strength to cope during crises. Nurses, however, are often unsure how to implement this kind of spiritual care. But despite the limitation on how to implement certain spiritual care, several studies have revealed that nurses do have a positive attitude towards spirituality and spiritual care in nursing practice. So, how do nurses view spirituality and spiritual care? Well, a research survey of Hong Kong nurses, 110 of them, was conducted by Shan and published in 2009, and it was to determine their attitudes regarding spirituality and spiritual care. This survey study showed that the greater the nurse's spiritual care perception was, the more frequently spiritual care was included in that nurse's practices. So applying this in spiritual care nursing situation, um, a nurse or nurses who are aware and are educated about nursing or spiritual nursing care would likely be able to integrate this into his or her practice of nursing. In addition, the findings revealed that nurses can provide spiritual care by praying with or praying for the patient, by also reading holy books, or by playing music that lifts the patient's spirit, and also by calling in spiritual advisors to talk to the patient. So it is important that nurses should use these spiritual resources to give patients and families the strength to cope during illness and spiritual crises. Spiritual care, when incorporated into nursing care activities, are considered spiritual activities and may include listening, giving silence, and touch. Okay, a touch by the hand, okay, to show comfort and presence. Spiritual care also include respecting the patient's religious and cultural beliefs, listening and talking with the clients, being with the patient by caring, supporting, showing empathy, facilitating participation in religious rituals, and promoting a sense of well-being, and also referrals to chaplains. So, for example, religious faith and spiritual beliefs may affect healthcare seeking behavior and people's willingness to accept specific treatments or behavior changes. So, for many religion, life does not end in death. Such a belief is worthy of recognition and gives rise to treatment and care preferences that are relevant to a judgment of what it is or what is in the best interest of the patient. So, example is when you have a patient who is a Muslim, okay? Muslim prayer occurs 5 times a day if possible, so assist patients in determining the direction to Mecca. Once prayer begins, be respectful of giving the patient privacy and a place to pray. Avoid interruption. It typically only takes a few minutes. Okay, bedridden patients may choose to remain in bed, and hospitals should also hire Muslim chaplains to be available to patients. Additional activities for spiritual care include planning by the nurse to take care of a person and not just managing a disease. Okay, so treating the patient as a person, a human being, not merely an object who has a disease, an object of care. uh, So humane caring. It is also an understanding of exactly what the patient wishes as an outcome of his or her disease. So in here, there is respect for patient autonomy. And for you to really be able to do that, you have to know the patient. Okay, there should be personal knowing in spiritual care. Another is being truthful and compassionate, which is the basis of mutual confidence in any relationship. So when the patient sees this in you, the nurse, that you are being truthful, that you are compassionate, then the patient would have that confidence of trusting you. And last but not the least is inclusion of prayer with the patient. So take note, it should be with the patient. For as long as the patient is able to converse with you or is conscious, okay, there is a lot of connection, human to human connection needed when giving spiritual care. So just spending a few minutes with the patient and praying together with the patient is already a great part of spiritual care to them. So, what are other strategies of spiritual care that the nurse could use to meet patients' spiritual needs? These are putting aside personal bias. Okay, so for example, you are a Christian nurse and you are taking care of a patient who may be an atheist or has uh, religious affiliation different from you, then as a nurse, you will have to put aside your personal bias. And you need to recognize that your patient may show you cues and verbal or non-verbal communication. Okay, so be sensitive to this. Recognize patient's cues and verbal communication. Some of our patients may not be um, open yet to praying, especially when they are suffering from a chronic disease or a condition that has no cure. You need to understand them and be sensitive in recognizing those cues and verbal communication that may give you ideas on what kind of spiritual care you may need to give your patient. So do not force your own spiritual beliefs or your own religious practices on your patient. Okay, making spiritual care resources such as private space for prayer and meditation. So you need to know if your patient would need this or not. Okay, and then be empathic. Okay, know how to put yourself on the shoes of your patient. Okay, ask yourself how would you want to be treated if you were the one on the hospital bed, uh, experiencing the condition and the situation that your patient is experiencing. So be empathic and include patient and family in healthcare decisions. So as much as possible, part of spiritual care is really um, being the facilitator, the mediator, or someone who connects different family members with the patient. Okay, you are like um, the the peacemaker. You are the person who binds connections. Okay, and you help them communicate with each other so they can come up with a unified healthcare decision together with the patient, and putting in mind that what decision they will be making is for the best interest of the patient. So in conclusion, spirituality and spiritual care is seen as providing a sense of direction. It is seen as giving hope and inner peace, allowing patients to accept and cope with problems, and thereby helping restore their sense of well-being through faith. Given the large number of patients being encountered who require spiritual care interventions, it is important to prepare nurses and for you to prepare as future nurses to provide spiritually based intervention in an ethical way. So emphasis is on spiritually based intervention and the ethical way. Okay, and this should benefit and support patient recovery or healing and peace. So majority of participants in a study expressed that the barriers to providing spiritual care include the following, and you should take note of this so you are able to um, contextualize your care and adjust with what you will encounter um, in your own practice. So the barriers are the following: a lack of time. So you may need to consider prioritizing this as much as possible, and modifying your schedule or your the management of your time with the patient to overcome this barrier. Second is uncertainty of how to provide spiritual care using spiritual care interventions. So with the uncertainty on how to provide spiritual care, that may need that may be addressed through open communication with the patient and the family, and appropriate adequate training and education. And then a lack of knowledge regarding diverse religious faiths. So you with this lack of knowledge, you will have to educate yourselves on the different religious faiths and practices, particularly when you will be exposed in a setting where you will be dealing with multicultural patients. So these are areas warranting attention in clinical nursing practice and nursing education. Okay, in this last part of the presentation, let's take a look at how some of your favorite theorists view spiritual care in nursing and other perspectives on spiritual care. Nursing, as defined by Jean Watson, consists of transpersonal attempts to protect, enhance, and preserve humanity and human dignity, integrity, and wholeness by helping a person find meaning in illness, suffering, pain, and existence, and to help another gain self knowledge, self control, self caring, and self healing, wherein a sense of inner harmony is restored regardless of the external circumstances. So you see, human beings have a wide range of physical, psychological, social, emotional, intellectual, developmental, cultural, and spiritual needs. And accordingly, one of the most important components of nursing care is that of spiritual care. And Watson used the term spirit and soul and referred to care as a transpersonal process, a process that is transpersonal between nurse and the patient, that has the potential for transcending the moment, okay, going beyond what is being experienced at the moment, and expanding human consciousness and healing capacity. To Florence Nightingale, spiritual care is the core of nursing care. So this nursing scholar, Florence Nightingale and Jean Watson, considered spiritual care as the core of nursing care. The Joint Commission on Accreditation of Healthcare Organizations also considers the delivery of spiritual care as a fundamental prerequisite to quality care, whereas the International Council of Nurses Code of Ethics for Nurses has also emphasized the importance of an ideal physical, social, and spiritual environment to patients' health. In providing spiritual care, a nurse's approach is to being with, okay? Being with. That refers to presence, okay? Just being there and being with the patient, not necessarily doing for them, okay? So again, spiritual care approach is more of presencing, okay, being with. Accordingly, nurses provide a comfortable environment in which patients can freely express their own spiritual anguishes, such as pain and discomfort, hopelessness, fear, and loneliness. Okay, so this still has some influence from Florence Nightingale's philosophy of nursing, considering the environmental determinants of health and healing. Dickinson, in 1975, who was an early pioneer in spiritual care, believed that spiritual care includes helping people develop the virtues according to the Erickson's developmental theory in the areas such as hope, will, purpose, and care. To Dyson and colleagues in 1997, spiritual care is the use of art and intuition in nursing. Lane, 1987, believed that providing spiritual care indicates the true humanity and complete professional commitment of a nurse. So you see, spiritual care is based upon unconditional love for human beings and affirming the unique value of every individual and their spiritual needs, and is under the influence of their cultural beliefs, physical status, thoughts, emotions, and relationships. Okay, so when you provide spiritual care, there has got to be some intentionality in you that you actually share a part of you, and that part of you is your love for another human being, and that expression of love is through spiritual care. Looking at this figure on antecedents, attributes, and consequences of the concept of spiritual care, you will have an understanding that spiritual care is a subjective and is a dynamic concept. Okay, so it's a subjective and dynamic concept. Subjective meaning there is no one specific definition of what it is. Okay, it depends on how a person defines it or looks at spiritual care or perceives spiritual care. It's subjective, and it's dynamic, so it can change. It changes. Okay, the spiritual care definition of this century may be different from the spiritual care definition or perspectives in the next century. Okay, so it's dynamic. It changes with time, and it is a unique aspect of care that integrates all other aspects. Okay, it emerges in the context of the nurse's awareness of the transcendent dimension of life and reflects a patient's reality. So the delivery of spiritual care is or leads to positive consequences such as healing, okay, promotion of spiritual here, so such as healing, promotion of spiritual well-being, and psychological adaptation, and feelings of satisfaction, okay, for patients, and promotion of spiritual awareness, as well as spiritual awareness and job satisfaction on the part of the nurse. And now on Filipino nurses' spirituality and provision of spiritual nursing care, let's try to understand what this means to Filipino nurses. Currently, the Philippine nursing program is a 4-year program consisting of general education and professional courses. And within the context of the curriculum, nursing education focuses on caring as its foundation, and the program subscribes to the following core values: the love of God, love of the people, caring as the core of nursing, and love of the country. And these are vital components in the development of a professional nurse and are emphasized in the Bachelor of Science in Nursing program. Okay, Philippines is considered the fifth largest Christian country and one of two predominantly Roman Catholic nations in Asia, third largest Catholic country in the world, and it's estimated that 87% of Filipinos are Christians, of whom 80.9% are Roman Catholic. So while more than 6 million Filipinos, or about 7% of the population, are non-Christians, most of whom are Muslim. In understanding the spirituality among Filipino culture, we need to know that majority of Filipinos believe that praying is a way of communicating between a person and the Supreme Creator. Other spiritual practices among Filipinos include the daily Eucharist or the attendance of the Mass, the use of sacramental or religious aids in the spiritual life, and these are the rosary beads, use of prayer, holy images, or even candles. Lighting of candles um, is part of that. In the academic platform, nurse educators may consider the integration of concepts of spirituality in nursing education and training. And this is what we are doing now in our BSN program. We have integrated spiritual care nursing into the theoretical foundations of nursing. Now, according to Narayanasamy and Narayanasamy 2010, nurse education is an ideal place where issues relative to spirituality could be explored. So make this an opportunity for you to explore your own spirituality and your own beliefs on spiritual care. So in conclusion, for nurses to better provide spiritual nursing care, the nurse must care for oneself through self-awareness, okay, self-reflection, and developing a sense of satisfaction and contentment. So you will have to begin with yourself for you to tread on further throughout this program and later on becoming a product of SUCN who is competent enough to deliver nursing care that is considered spiritual. In turn, the nurse will be able to relate themselves to others, okay, so to the Supreme Being, okay, to the environment, and eventually to your future patients. So again, begin with yourselves. So here is the challenge for the academe. Student engagement in learning spirituality may be fostered through non-traditional learning strategies such as simulation activities, role-playing, games, and the use of reflective journals. So throughout your experience in the SEC and BSN program, you will be engaging in these several activities all throughout the year levels. For nurse educators, they may also require students to submit a written journal, nursing care plans, and anecdotal records of demonstration of spiritual care provided, and summative self-assessment on integration of spiritual care during the clinical exposure. So you will have the opportunity to engage in these activities as you go through our program.
Historically, nursing has its roots in holistic care, with nurses defining their role primarily in spiritual terms. Florence Nightingale, one of the most influential historic nurse figures, was a strong advocate for spiritual care. However, with the arrival of the scientific and technological era, the focus on holistic care, including spiritual care, began to wane. In recent years, however, there has been a resurgence of interest in holism and spirituality within nursing, as evidenced by the proliferation of articles and books on the subject in the nursing literature. There is ample rationale for including spiritual care in nursing. If you look at various definitions of nursing, it can be seen that they are focused on holistic care. The role of the nurse is to help clients achieve their maximum health potential, health being broadly defined. Many nurse theorists include the spiritual dimension in their nursing models, for example, Betty Newman and Jean Watson. A number of studies indicate that clients perceive that they have spiritual needs which are important to them, especially in terms of health crises. The research also shows that there is a definite connection between a person's spiritual well-being, their comfort level, and their response to illness. It follows then that if spiritual needs are not attended to, this lapse will likely have implications for the level of health achieved by the client. If nurses are to fulfill their mandate, then spiritual care should be one of their responsibilities. This fact is recognized by codes of ethics for nurses. For example, the ICN Code of Ethics states that the nurse promotes an environment in which the human rights, values, customs, and spiritual beliefs of the individual, family, and community are respected. So you can see that in many ways, nurses are ideally suited to be involved in spiritual care. And this is becoming easier to do in the social climate of today, where there is a general trend to be open to exploring issues around spirituality. In this video program, we will look at the place of spirituality and spiritual care in nursing practice through the eyes of Robin, a nurse who has worked primarily in acute care settings in her nursing practice.
Nurses are suited to be involved in spiritual care because they are faced with the vulnerability of humanity every day. And it's in times of vulnerability that people really reach out for spiritual care, spiritual help. They may not say it directly, I need spiritual help, but when people are in crisis, when people are faced with challenges, physical challenges, health challenges, they're looking outside of themselves and within themselves for the strength to carry on. And you can tell, you know, when you're speaking with them, that they are almost inviting you in sometimes by what they say. Some people don't, and you totally respect that because that's what they are. Nurses provide care for what is needed, and you get to see the need because you're with them all the time. I just think that whether people prescribe to a certain faith or not, spirituality is universal. And it is the source of why people act and think. And sometimes in order to get at the root of certain behaviors, certain actions, is to address those underlying spiritual needs. Yes, the person may be sick and everything like that, but if they're actually just very confused about why is this happening to me and things of that nature, if you don't actually address the root problem, the behavior and the question will continue.
If nurses are critical in terms of attending to the spiritual dimension of health in clients, how can they begin to tackle such a task? Well, nurses need to be aware of how their clients define spirituality. And they must respect clients whose view of spirituality may be different from their own view. This will enable them to be better able to assist clients in meeting their spiritual needs. But first of all, nurses need to begin with themselves, to clarify their own spiritual positioning, and to be aware of their own spiritual needs and their own spiritual quest. This is important, as the literature shows that nurses who have a strong sense of their own spirituality are better able to provide spiritual care.
I think the biggest piece in preparing yourself to providing spiritual care is to attend to your own spiritual needs. Taking time for yourself, quiet time, thinking about what you want in life, understanding yourself why you're feeling stressed and attending to that are the first steps in learning about spiritual care, because you're attending to your inner life. And when you attend to your inner life, then you recognize that other people have inner lives too. It was just something that was a part of me, and because it was an important part of me, I always looked to see if it was an important part to somebody else. So attending to your own personal needs, to your own spiritual needs, I think is primary.
Nurses also need to develop qualities that are essential to excellence in nursing practice generally, such as being non-judgmental, being truly present with the client, being open to talking about spirituality, that is, taking risks and asking questions that may be personal, having a commitment to give to the client, being curious, being authentic and compassionate, having good interpersonal and communication skills, and so on. When it comes to spirituality, nurses also need to be willing to live with the ambiguity and mystery that often surrounds spirituality, not feeling that they have to have all the answers. In order to provide effective spiritual care, a key skill for the nurse to acquire is the ability to be able to assess within the realm of spirituality. All nurses, regardless of their own spiritual positioning, need to develop competence in this skill, and there are various spiritual assessment tools to help them. Nurses can naturally weave assessment questions into conversations with clients. For example, a nurse can ask a client, "Is religion or spirituality important to you?" Or, "What gives your life meaning and purpose?" The nurse can also engage in conversations about spirituality based on unprompted cues provided by the client.
Some cues that patients may give you that they need spiritual care are open-ended statements that are very hard to answer. Like, "So what does this all mean?" Or, "I never thought this would happen." Um,
Okay. Remember to take care of yourself because you cannot pour from an empty cup. Okay, self-care matters. These are the references of this presentation. Thank you for listening. Have a wonderful day.